Hi, my name is Jamie Riddell. I'm a neonatal nurse practitioner with Seattle Children's Hospital, and I've been working here at Providence since 1996. I started as a LPN and just worked my way up through the ranks, so I've done everything from LPN to RN to nurse practitioner. I understand that education really helps us do a better job, and so we really want to talk today about the late preterm policy. Late preterm infants are much more likely to have comorbidities related to their prematurity, so it's important to start teaching the families even before birth and immediately following birth what's expected for discharge. We want to make sure these babies have been monitored for an extended period of time and the surveillance has been adequate, and so these babies will be staying for 48 hours or longer as needed. It's really important to make sure the family is aware of that they're not going to be going home in 24 hours or 18 hours because they've had 4 other kids. It's not so much about making sure that they can take care of their baby, which is important, but it's also about making sure that that baby is going to be able to sustain normal behaviors like feedings, staying warm, and normal sugars. Education should start right away, as we discussed, making sure that they have a pediatrician picked out early on, understanding when to expect to go home, and what's expected before they can go home. So having an established feeding plan that's going well for at least 24 hours. We want to make sure that that baby's able to sustain feedings, whether it be by breast, whether it be with a supplemental nursing system, whether it be finger feedings or even bottle feedings. Just making sure that they're able to sustain. It's not uncommon for a 35-weeker to come out of the gate great, be able to feed for 12 to 14 hours, have no problems, and then as we're expecting increasing volumes, that baby is unable to take those feedings. So supplementing in the first 24 hours we expect about 30 per kilo of supplement if the baby's not breastfeeding well. The second day is about 60 per kilo and up as the baby gets older. So as we're expecting the baby to take more volume, oftentimes they are unable to sustain that. And we usually can tell that within about 48 hours if they're unable to sustain adequate feedings. Making sure the baby's voiding and stooling appropriately, making sure their vital signs are stable for at least 24 hours before they can go home, and finishing all those normal monitoring and surveillance that we do, including a CARSI test. One thing I like to tell parents of late preterm babies is that the baby's head control, neck control, core strength is not as good as a term baby is. So you wouldn't want to leave that baby in a car seat for long periods of time. Although our car seat test is 90 minutes, that would be the extreme of what we would want a family to do. If they're going to be taking a long trip, take a break after an hour, lay the baby flat on the ground, kind of recuperate, feed, whatever they need to do to give that baby a break. That also goes to say, don't put them in swings until they're a little bit older. The little reclined bouncy seats are okay, but making sure that they're not living in those things for long periods of time. If they are using those devices, make sure that their positioning is appropriate, that their airway's nice and open, and that they're not cutting off their air supply when they're reclined. Some of the other things you want to talk to your families about throughout the hospital stay and before discharge are things like preterm feeding cues or preterm stress cues. And although you may not have had a lot of education regarding the preterm stress cues, they are things that you might think are kind of cute. Sometimes hiccups, for example, is a stress cue in a preterm baby. Not being able to stay awake and just falling asleep immediately when they're engaged. Eye aversion is another stress cue. So if you're messing with a baby and they're really not looking at you, you're trying to feed them and they're constantly looking away or immediately falling asleep, that's actually a stress cue that they're having too much stimulation. The things you want to see are those feeding cues. You want to have an engaged visual, eye-to-eye contact. You want to have a baby who is maybe nibbling on their hands, or just those normal feeding cues that might be more subtle than a term baby but are still there. Having the family be aware that the baby does need to sleep for prolonged periods of time, so not having lots of visitors, not passing that preterm baby around a lot. The baby is at heightened risk for infection and viruses simply because their immune system is not as strong as a term baby is. Model good hand hygiene and discuss good hand hygiene as you go. Model good safe sleep positions and discuss what that looks like. And then have those discussions with those families who smoke both tobacco and marijuana, that there is a heightened risk for apnea in smoking homes in preterm babies, as well as a increased risk for SIDS, both with preterm babies and with smoking and marijuana. And finally, we really just want that baby to be able to show us that it's physiologically stable before discharge. So having normal vital signs for about 24 hours prior to discharge, meaning a heart rate of 100 to 160, a respiratory rate of less than 60, and then having normal temperatures and normal glucoses. Making sure that baby is voiding and stooling as expected, making sure that the feeding plan is documented and understood and reiterated by the family, that they understand what the feeding plan is when they go home. Having a pediatrician appointment set up, having access to resources such as social work, a pediatrician, and to lactation, really important. And then just making sure that they have all their questions answered, that they understand safe sleep practice, that they have something set up at home, they understand the smoking, including marijuana, tobacco, and vaping. All those things are contributing to a less healthy late preterm baby. So just making sure that they understand all those educational points. Another really important thing to have families understand is that this baby is preterm, so they really shouldn't have even been born for another 4 to 5 weeks. In saying that, it's really important for them to understand that a baby grows when it's sleeping. A baby gets healthy when it's sleeping. So clustering care is very important. Have the baby feed, not more than 30 minutes for a total feeding, and then have the baby allowed to go back to sleep. You can hold the baby, you can have them in skin to skin, but don't be having tons of people over at your house, passing the baby around, keeping the baby awake for prolonged periods of time, because that eventually will become a detriment for that baby. A very important prior to babies going home is the families to understand and be able to verbalize understanding related to jaundice, the feeding plan, watching for dehydration, and for weight loss, and just understanding what those things look like. Having them understand when to call the doctor and when to be concerned is very important. So in conclusion, I just wanted to go over some of the most common complications related to preterm babies, which include poor feeding, hypothermia, hypoglycemia, dehydration, severe jaundice, and weight loss with dehydration. If a lot of the problems can be prevented with just good surveillance and education, and really want to just try and keep these babies with their families and have them go home in a safe way. So thanks for joining us today, and we will have some links and review at the bottom. Thanks.